Achondroplasia, or short-limb dwarfism, is a mutation of the FGFR3 gene.
It's a dominant mutation, so Morgan and I both have it, and our future children have about a 75% chance of having it as well.
We came to our geneticist to talk about our options.
We just finished building a house that suited our needs. The counters, tables, etc. are shorter to make life simpler for us, but we do have normal-sized doorways, chairs, ceilings, etc. for normal-sized guests.
But we're concerned about the 25% chance that our child would not have achondroplasia and may not feel comfortable in our house.
This is Sam Sparks with Crazy KZ News, and I'm here at the Margaret Mary Hospital today following a couple who both have achondroplasia and are going in to talk to their geneticist today about starting a family. For those at home, achondroplasia is a genetic mutation that causes short-limb dwarfism, the average height being 4 feet 4 inches.
As Ben said earlier, we just finished our house. We are in the middle class and our insurance coverage is about 90%. I wanted to ask you, Dr. Blasi, about my choices for having a kid.
Curiously, 80% of people with achondroplasia did not inherit it from either parent, but rather it was just a mutation. This mutation occurs on chromosome 4 and is at a single locus. It has 100% penetrance and variable expressivity, which means that if you have the mutation, you will have achondroplasia. However, your height may still vary a little bit. People with achondroplasia do have a dysfunctional enzyme which prevents the conversion of cartilage into bone in the long bones of the arms and legs, particularly in early development.
Oh, wow. I was wondering if you could explain our genetic test results for us.
So, achondroplasia is an autosomal dominant trait, which means that having even one copy of the mutation will cause you to have achondroplasia. The genetic results for you and Ben indicate that this is the case. You are both heterozygotes, which means, according to my glorious Punnett square here, that you have a 25% chance of having a normal-sized child and a 75% chance of having a child like yourself.
Oh, so our child does have a 25% chance of being a non-achondroplasiac. Ben and I are concerned about raising a full-size child. We have toyed with the idea of choosing an egg and sperm that would make our kid like us. Can you tell me more about that?
So what you're talking about is pre-implantation genetic diagnosis. It's a very low-risk procedure, which is more or less just slightly more choosy in vitro fertilization. However, because of this and several other reasons, it is a controversial topic.
Let's talk more about that controversy. Pre-implantation genetic diagnosis is a screening test to determine if chromosomal disorders are present in fertilized embryos before they are implanted into the mother. Doctors use this process to prevent fatal or harmful disorders, which leaves some people concerned, is the genetically perfect child just a doctor's bill and a syringe away? Some might ask, why would you choose to or not to have a child with achondroplasia, since the mutation does not shorten lifespan or place severe financial burden on the family, and they can lead normal, productive lives?
Dr. Blasi, can you tell me a little more about achondroplasia?
This rarely affects overall health and lifespan of an individual, but can cause deformities of the spinal column, joint pain, and complications in pregnancy and early development.
Complications in pregnancy and early development?
As long as you have good, well-educated prenatal care and the child is monitored throughout development, you can avoid most serious complications. You will likely need a C-section due to your relatively small pelvis, and the child would need yearly checkups to monitor their growth and development. They may or may not need a surgery which would open a space in the bottom of the skull to create a hole which would have otherwise developed.
Yeah! Sam Sparks!
Alcohol, my permanent accessory. Alcohol, a party time necessity. Alcohol, alternative to feeling like yourself. Oh, alcohol, I still bring to your health. I love you more than I did the week before. Forget the cafe.